Bangladesh is one of the hardest hit countries because of climate change, and this is where it is happening. In this place called Dokhinpara, it's in Chakaria, very close to the coastal area, about 8 to 10 miles from here. What we have found from our studies done in this part of the country is that climate change causes increase in ambient temperature, humidity, and it also causes an increase in salinity in the environment, salinity of the water. And because of all these things, probably there is an increase in the prevalence of miscarriage, a very grave observation that our scientists have found. At the same time, our scientists also have found that in this particular population living in the coastal area, the prevalence of gastrointestinal diseases, and in particular diarrhea, is higher than what we observe in the hinterland. In addition to that, the overall mortality among children is also increased when we compare to hinterland areas such as Matlab.
গত 30 বছরে চকরিয়ার 49টা গ্রামে আমরা 80,000 মানুষের উপর গবেষণা করতেছি। আমরা এখানে দেখছি সমুদ্রের নিকটবর্তী যে পরিবারগুলো আছে তাদের মধ্যে লবণাক্ততা গ্রহণের পরিমাণ WHO গাইডলাইন অনুযায়ী যেটা থাকে তার তুলনায় প্রায় 3 গুণ বেশি। এই লবণাক্ততার জন্য মানুষের স্বাস্থ্য সমস্যা, যেরকম এই এলাকার মধ্যে আপনার শিশু মৃত্যুর হার অনেক বেশি, গর্ভপাত বেশি, তারপর কিডনি জনিত রোগের কারণে মৃত্যুর হার বেশি, এবং এটা কোনো এলাকার তুলনায় এটা প্রায় 2 গুণ বেশি।
To understand more about these health impacts and to find out mitigating solutions, iCDRB has embarked on a very long and ambitious project. And this project is to find out what the role of the gut microbiota is in connecting climate change with the health impact. Gut microbiota means the germs that inhabit the small and the large intestine of the human body, mostly in the large intestine. Some of them are really good, and we have a symbiotic relationship with these germs, but there are some that are not beneficial for the human body. So it remains to be seen how the impact of climate change in the form of increased salinity would disrupt the normal gut microbiota and the intestinal ecosystem. When it is done this way, then there may be huge perturbations on the immune system as well as nutrition, and thereby the illnesses that we have mentioned, they could be manifest. We are going to do a number of surveys looking at the health impact of people who are living in this climate change prone area, as well as collect biological samples.
By teaming up with iCDRB and their scientists, community health workers, social scientists, demographers, what we hope to do is to bring the science that we're generally doing in the UK, the genomic science, and apply that to questions which are relevant to these communities here, as well as explain why so many communities are suffering from climate change in a similar way to these communities here. The most amazing thing about this whole area and the Chakaria campus is that the community is driving these conversations. They're driving the research. They're driving the questions that actually iCDRB are trying to help and to assist with, whether that be community health insurance or whether that be changing patterns of climate.
At the end of this study, we will be able to find out the mechanism by which climate change is affecting our health and mental well-being. At the same time, this climate change hub that iCDRB has established right where climate change is happening, this will lead to more future observations that are going to lead to more meaningful solutions for climate change and its impact on health.